Fall is a beautiful time of year, but not everyone looks forward to it because it's virus season. However, the good news, there are vaccines, and that's what we're talking about today. We're joined by Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Corey Frederick, a clinical coordinator, infectious diseases. We're here to separate fact from fiction, as well as answer your questions. So get ready for this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, everyone. I'm Olga Villaverde, and welcome to Ask the Doc, the show where we encourage our viewers to send in your questions, and questions we have and answers are coming. Today's first question comes from Randall, who reached out to us through our website, allhealthtv.com, and here it is. Hey, doctors, I'm a 55-year-old guy who was reading about shingles and didn't think it was an issue for me. But then I remembered that I had the chickenpox as a kid. So now I'm wondering if I should get the vaccine. You know, Dr. Camejo, I love this question. I'm the same age and I haven't gotten mine. So here we go.
So Randy, can I call you Randy? That is a really good question. But before I share my thoughts, let's check out this video from the Mayo Clinic.
The burning pain of shingles makes you feel like your skin is on fire.
It's caused by the same virus that causes chickenpox.
Dr. Vandana Bidet says after you've had the chickenpox, the virus can live in your nervous system for years. No one's sure why it reappears, but the thought is if your immune system weakens because of illness or the aging process, the virus can reactivate and travel along your nerves to your skin, causing severe pain and blisters. The pain can happen days before the rash erupts. There's no cure, but medication may lessen symptoms and shorten suffering. A vaccine recommended for people age 60 and over can help prevent shingles.
We know that it will significantly decrease the risk of getting shingles in these people, and it will also decrease the risk of something called post-herpetic neuralgia, which is this very painful kind of phantom pain almost that's in the region where shingles was, but is after it's already healed.
For the Mayo Clinic News Network, I'm Vivian Williams.
So you are correct, Randy, that both shingles and chickenpox are caused by the same virus, the varicella zoster virus. However, this scenario is different from what we commonly think of when we get sick. So the virus first enters your body when you have the chickenpox, and after you recover, it lays dormant in your body for years and decades. Think of it as hiding out, and later in life, that virus can reactivate. So when reactivated, this is what we call shingles infection. Unfortunately, shingle can cause a very painful rash, as you saw in the video, that's itchy, tingly, and potentially lead to more serious complications. So the CDC recommends that 1 in every 3 people in the United States will develop shingles at some point in their life. So getting that shingles vaccine can really help the shingles and other potential complications. And it's really recommended for adults 50 years or older. So get your vaccine.
Really glad I asked that question from Randy because now it's my turn to get it. Thank you, Dr. Camejo. All right, so a YouTube question from Camila, and this is what she writes. Dr. Camejo, I wanted to say that my hubby and I love your sense of humor. Oh, that's so sweet. So we're talking about getting our flu vaccines soon, but now that we're in our 60s, we're wondering if we should get the RSV vaccine as well. I'm concerned because the flu vaccine takes me out of commission for a few days, and I want to know if RSV does the same thing. Dr. Camejo, great question here.
Hi, Camila. Thanks for reaching out with your question. Love that you're asking such an important question. Dr. Fredericks, who is an infectious disease specialist, this is up your alley. Answer her question.
Thanks, Dr. Camejo. The RSV vaccine, which stands for respiratory syncytial virus, is relatively new. At this time, it's recommended to vaccinate all adults older than 75 years of age, and for adults who are between ages of 60 and 74 who are at an increased risk for severe RSV. So who is at risk for severe RSV? There are numerous risk factors, including those with chronic heart diseases, lung diseases, and diabetes, just to name a few. Ask your doctor or pharmacist for more information about what specific risk factors for RSV that you might have. Now, as far as the RSV taking you out of commission, the studies do indicate that about a third of patients may report fatigue or headache following vaccination, but a day or two of taking it easy is far better than an actual RSV infection. RSV can cause mild cold-like symptoms in many patients, but in infants and older adults, it can be very serious and require hospitalization. Furthermore, by getting your vaccine, you can help prevent the spread and protect those around you who may be vulnerable to severe RSV infection.
Thank you so much, Doctor. Another question just came in from Lucius, and this one is from allhealthtv.com. Hey, Dr. Camejo, my wife, Elijah, and I are pregnant. Congratulations. It's our first time, and maybe I'm being overcautious, but should Elijah forego getting the flu vaccine this year, because she's pregnant? I remember thinking the same thing when I was pregnant way back when, Dr. Camejo. I love this question.
Olga, I agree that it's a great question. And Lucius, thanks for reaching out. In fact, this may be the most important year for you to get your flu vaccine. It's highly recommended that pregnant women receive their flu shots during flu season. Not only is the flu vaccine completely safe to receive when pregnant, but it will greatly protect both mama and baby. Influenza, much more likely to cause severe illness requiring hospitalization in pregnant women versus women with the same age who are not pregnant. So additionally, fever, which is a common symptom in influenza, has been shown to cause developmental issues for newborns. So getting that flu shot means you can pass along important antibodies to the baby and protect them for their first months of life. It's a win-win.
Thanks so much, Dr. Camejo. So in case you missed it the first time, here's another opportunity to find a way to send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hannah. Ask Hannah is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hannah has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit AskHannah.tv today and take control of your health with Ask Hannah. Your health, your way, anytime, anywhere. Ask Hannah, your trusted health companion.
All right, we got our first Instagram question, and this one is from Valentina. Let's see what she writes. Hello, Doctors Camejo and Frederick. I'm a 24-year-old sexually active woman. I remember hearing a lot about HPV, human papillomavirus, a few years back, but I never got vaccinated. I meant to, but I was also too busy. Should I still get the vaccine? Dr. Camejo, this is a great question, especially with her age right now. Your thoughts?
That is a great question, Valentina, and I love it when patients advocate for themselves and reach out for information. Dr. Frederick's got some great advice, but before he answers, let me check out another video from the Mayo Clinic.
No matter how careful you think you've been, you've probably had a sexually transmitted infection at some point. In fact, human papillomavirus, or HPV, is so common that almost every single one of us will get it at some point in our lives.
Most of them will resolve that infection, but many will not. They will be left with untreatable genital warts, or later in life develop a whole variety of cancers as a result of that viral infection.
But there's a vaccine that's extremely effective at preventing HPV. Until recently, only young people up to the age of 26 were able to get the vaccine. But Dr. Gregory Poland, head of the Mayo Clinic Vaccine Research Group, says that recently changed.
Now that has been extended up to the age of 45.
And it's not just HPV you'll be protecting yourself from.
This is a vaccine, I like to tell people, against sexually transmitted cancer. That's its importance.
For the Mayo Clinic News Network, I'm Ian Roth.
The HPV vaccine is recommended for everyone through 26 years of age. HPV, or human papillomavirus, is a common group of viruses prevalent within the community. In fact, there are more than 200 types of HPV that clinicians are aware of. HPV is very common. Many people develop an HPV infection without ever having signs or symptoms, but unfortunately, some HPV types are associated with certain types of cancer. The HPV vaccine targets some of these high-risk HPV types, and so not only can the vaccine prevent HPV infections, The vaccine is also a form of cancer prevention. The American Cancer Society estimates that this vaccine can prevent more than 90% of HPV-related cancers in older adults. Additionally, in adults ages 27 through 45 years of age, they may decide to get the HPV vaccine based on a conversation with their doctor or pharmacist.
Fantastic information. Thank you so much. We've got another YouTube question, and this one's coming in from, let's see, Cade. And here is what they write. Cade says, esteemed doctors, my cousin keeps writing me about getting a pneumococcal vaccination. Is it really necessary? What will it protect me from? Dr. Camejo, this is right up your alley.
So Kate, secondly, your cousin is absolutely right. The Streptococcus pneumoniae can be a very nasty bug, and it's the most common culprit of pneumonia within our community. Additionally, strep pneumo can cause sinus infection, ear infection, and other serious infections like meningitis. And receiving the pneumococcal vaccine is for sure a fire way to ensure that you don't catch any nasty case of strep pneumo. Now, there are major updates to the pneumococcal vaccine recommendations. The FDA has approved that the CDC has recommended a few new vaccines over the past few years. And additionally, the CDC has recently lowered the recommended age for the pneumococcal vaccination. So the PCV 15, PCV 20, or PCV 21 are now recommended for all adults over the age of 50. So make sure you talk to your doctor or pharmacist and ask any further questions you may want about the pneumococcal vaccine.
Great stuff. Okay, so I've got a really interesting question here. It's on Facebook and it's from Brooke. Here is what she writes. Hello, doctors. I work at a daycare center that caters to infants and toddlers. Knowing this, my doctor suggested that I get a Tdap booster. I was with my sister when my infant niece got her Tdap. My question is this: why do I, as an adult, need to get this kid's vaccination? Dr. Frederick, what about this one?
Brooke, thanks for reaching out. Let's start by breaking down what's in the Tdap vaccine. So the T stands for tetanus, bacteria that can cause painful, stiff muscles and lead to very serious complications. D stands for diphtheria, which is a bacteria that can lead to an infection which makes it difficult to breathe. And lastly, the P stands for pertussis. Pertussis, also known as whooping cough, is a very hard and strenuous coughing that makes it difficult to breathe and eat. Pertussis can be very dangerous for infants and toddlers. So, Brooke, you are correct. These vaccines are part of our normal childhood vaccine series. However, because you work in a daycare around infants and toddlers, it's recommended adults be up to date and receive a booster to best protect little ones. Additionally, because the Tdap vaccine contains a tetanus vaccine, this also keeps you protected from sources of tetanus within the community. Generally, it's recommended adults receive the Tdap booster once every 10 years.
Fantastic. All right, Dr. Frederick and Dr. Camejo, I have a three-fer here, so I have a feeling you're both going to be chiming in here. This is from Ahmad, and it's on Instagram. So let's take the questions. Hey, docs, I have a couple of questions about COVID. I never got vaccinated, and I never got COVID. So could I be naturally immune? Number two, aren't you better off taking ivermectin? And number three, I'm not hearing much about COVID, so is it still an issue? Oh, I like this, especially the ivermectin. I don't even know what that is, Dr. Camejo.
So, Doctor, thank you very much. But Olga, unfortunately, you're only too right about the all these questions. Ahmed, thanks for writing in. And let's start with your first question regarding natural immunity. You know, immunity involves your body being exposed to a particular virus or a bacteria and then developing antibodies or defense against it. This prevents you from either feeling sick again from that bug, or you're currently or greatly reduced on how sick you feel the next time you're exposed to it. So it could have been possible that you were exposed to COVID-19 sometime over the past few years, and you were just asymptomatic, meaning you had no signs or symptoms of the infection. As COVID-19 continues to evolve, think of it's like changing outfits. So the next time your body may not be able to recognize it as well. And this is why it's so important to stay up to date with the latest recommendations and get your COVID-19 booster if eligible. So this ensures your body knows which clothes the COVID-19 virus might be wearing and it's prepared for it. But I'd like Dr. Frederick to really address your last two questions, which is especially the one about ivermectin.
So ivermectin has not been proved to be effective in any shape or form against COVID-19. So ivermectin is useful for other types of infections, like for treating various parasites, not for COVID-19, which is a virus. As ivermectin is a prescription medication and not available over the counter, this should not be an available option for treatment. Some people have reported ignoring medical advice and using animal ivermectin products, but since these products are intended for animals and are at a different strength and concentration, this can be very dangerous for human consumption. Last, as far as your question about not hearing much about COVID anymore and it no longer being a big issue, well, this interpretation is due to a variety of reasons. So widespread immunization, repeat COVID-19 exposures and infections, the FDA approving effective treatment options, and circulating COVID variants being less likely to cause severe disease. All these things together have made COVID-19 a much more manageable respiratory illness than from a few years ago. But that can still change if we're not careful. Even still, some patients with COVID-19 today can still cause severe disease and require hospitalization and need a ventilator to help breathe. So for that reason, it's important to still take COVID-19 very seriously and heed all recommendations for COVID-19 vaccinations to best protect yourself and loved ones.
Thank you so much. All right. So if you've got questions, we've got answers. And in case you missed it the first couple of times, here's a way for you to chime in and let us know about your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, so this next question comes in from allhealthtv.com, and we are hearing from Felicia. Here's what she writes. Hey, Dr. Frederick, is there a vaccination for meningitis? I occasionally hear stories about kids and teens getting the disease. So Dr. Frederick, would you like to chime in on this one?
Absolutely. Excellent question, Felicia. We appreciate you writing in. Yes, there is a vaccine available to prevent meningitis. Actually, there are two. In a previous question, we talked about the pneumococcal vaccine, and that can help prevent pneumococcal meningitis. But there is another bug within the community known to cause meningitis, and that bug is Neisseria meningitidis. For this bug, we have a few vaccines available. These vaccines all differ in which types of bacteria they cover, and therefore your physician or pharmacist can help guide you on which meningitis vaccine would be needed based on your age and associated risk factors.
All right, fantastic. Thank you so much, Doctor. Okay, the next question is coming in from Facebook, and I believe it's Taylor. Let's see what they are writing in. Hi, Dr. Camejo. I've got a bet with some of my friends. Ooh, that sounds nice. And I'm hoping you got my back on this. Isn't it possible to get the flu when you get the flu vaccine? That's what my older brother Tyson told me. All right, Dr. Camejo, I don't know about you, but ever since I was young, even to this day, I keep hearing from my family and friends, don't get the flu vaccine. You're gonna get the flu.
Well, Olga, I have to tell you, Tyler might be want to hit the bank right now because it looks like you're going to owe money to your friends there, Tyler. The quick answer is a resounding no. Receiving the flu shot does not and cannot give you the flu. The flu vaccine is actually made in a way that does not allow it to cause infection. Now, some people may experience mild side effects after the flu shot, such as soreness or at the injection site, mild fever, or even body aches, which may be mistaken for flu symptoms. But these are just normal immune responses as your body is really preparing itself to fight against the flu season. Now, typically, they usually go away after a couple of days. However, these side effects are generally far milder and shorter lasting than the actual flu. So while you may feel the need to, act like, the flu may be happening, but it isn't. While you feel tired for a day, getting that actual vaccine is really better than feeling terrible with high fevers, chills, and cough for a couple of days. Now, in some high-risk patients, the flu can make them sick enough to need hospitalization. So let Tyson and your friends know that you got this one wrong. You can't get the flu from the flu shot.
Thanks so much for clarifying, Doctor. All right, Dr. Camejo, don't go far because we're going to allhealthtv.com. And I have a question from Leanne, and this is what she writes. Dr. Camejo, can I still get the flu virus if I'm allergic to eggs? Thoughts, Dr. Camejo?
Sure. And great question. But the CDC recommends that everyone with the ages of 6 months and older who have a who have an egg allergy still receive a flu vaccine. Now, this means that any flu vaccine that is egg-based or non-egg-based, having an egg allergy doesn't require additional safety precautions from those without egg allergy. In a rare event, a reaction or a healthcare professional trained to give vaccines are trained to administer medications to help if you get an allergy during one of those symptoms. But there are some vaccines now that are made for those who have egg allergy. You just need to request it and make sure your pharmacist or doctor makes sure they prescribe for that as well.
All right, we have about a few more questions to go, and they are still fantastic. This one is on our Instagram social media, and it's from Dason. And this is what Dason writes. Doctors Camejo and Frederick, please explain how a disease like chickenpox eventually turns into another disease like shingles. What's up with that? Dr. Frederick, we talked a little bit about shingles. So in case someone's joining us now, let's remind them again what I guess the rules are for shingles. Like I said earlier, I haven't gotten mine, so I think I have to, as Dr. Camejo started off at the top of the show.
Great question, Dason. Chickenpox can turn into shingles because they are in fact the same virus. After being exposed to chickenpox typically early in life, the virus remains dormant in nerve cells. And so what that means is essentially the virus is hiding out, and it can hide there for years and even decades. Then when somebody is older, that virus can reactivate and can kind of wake up and can cause symptoms. So when it reactivates later in life and develops symptoms, this presentation of that same virus we call shingles.
All right. And Dr. Camejo, refresh my memory here, if you don't mind. When you get the shingles shot, is it 1 or 2? And how does that work?
It's usually 2, and they're separated by a time period. But usually you'll get your first one, and then Corey, remind me, is it usually a couple months later you get the second one, correct?
Correct. Yeah, so they're spaced out, and it's always important to make sure that you do
follow up.
And can one expect maybe some reaction to that?
Some people do, just like, the thing is, when you're getting vaccines, people don't realize your immune system is starting to work, right? So when it starts to work, because it's going to develop an immune to shingles or to the flu or to anything, your body goes through a reaction. If you're experiencing that, that means it's good, because guess what? The vaccine's working for you, right? So that's why some people feel like, oh, I must be getting the flu or I must be getting sick. It really isn't. It's your immune system beginning to develop the antibodies that it's going to need for you to actually fight off if you ever get exposed to an infection.
All right. And we have a couple minutes left. And I have a question from someone who wanted to remain anonymous, but this I'm going to ask to both of you, if you don't mind, because it is something that has been posed in the news, and maybe you can help clarify. But many parents very skeptical when they have their children about vaccinations. Does it cause autism? So can we kind of talk about that just a little bit? Dr. Frederick, I'm going to start with you.
Absolutely. And, of course, your child's safety is the top priority, not just for yourself, but for your child's clinicians as well. There have been numerous evidence and studies throughout the past several decades exploring possible links of autism and routine childhood vaccinations. And so far, there has been a resounding amount of evidence that shows no association between those. Now, where there was this original misconception is typically the initial signs and symptoms of autism. Those develop within the first few years of life, usually around the time when children are getting their normal pediatric vaccine series. So a lot of times there was this causation, we thought, or this association, but it wasn't necessarily caused by the vaccine. So for this reason, there have been a lot of research in this area, and the data is overwhelming in support of not only that vaccines are safe, but there are no links between children receiving vaccines and developing autism.
Great information. Thank you so much, Dr. Camejo. I'm going to end with you. We got about a minute left. Maybe a quick recap and what vaccines you feel are really important that people should not deny themselves.
Well, at the end of the day, as we get older, make sure you get your pneumococcal, your RSV, shingle shots. Those are great. But just to talk a little bit more about the children's vaccines as well, is, we all got vaccinated when we were kids. It's always been that. And at the end of the day, vaccines will prevent childhood diseases that we got rid of many years ago.
All right. So the bottom line is I still have to get my flu shot. Check. I'm going to, and I still have to do the shingles, which after this conversation, I'm finally going to do. Thank you to both of you. I really appreciate your expertise and your time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hannah. Ask Hannah is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hannah has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit AskHannah.tv today and take control of your health with Ask Hannah. Your health, your way, anytime, anywhere. Ask Hannah, your trusted health companion.